Can everyone see my slide?
Yes,
If you hear me clearly,
yes, doctor. Yes. Yes.
right, is the slide moving?
Yes, yes.
Right. Okay, Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli amma ba'd. So alhamdulillah nawaitu ta'luma wa ta'lima wa naf'a wal intifa' wal ifadah wal istifadah wal hasan at-tamasuki bi kitabillahi wa bi sunnati rasulih sallallahu alaihi wasallam wa ibtigha wajhillah wa mardatihi wa qurbihi wa sawabihi amma ba'd. So today alhamdulillah we'll be talking about the fifth topic corresponding to the third lab session. Okay, which is blood film. Okay, so we have talked about how blood is collected. Yeah, the technique used is called phlebotomy, and then what would happen to the blood afterwards? Yeah, in terms of the basic hematological investigations that will be carried out, and what is the major role of biomedical scientists at the laboratory. Yeah, you'll be the gatekeeper, you'll be checking whether the sample should be accepted or rejected. There are criteria for it, and there are things that we need to think of at the lab level in terms of its management, QA, QI, and QC. And now we come to one of the techniques that is normally encountered in the hematology lab, which is the blood film. Okay, so we're talking about the techniques used, and then briefly on the staining methods, and finally on the differential counting. Okay, have you heard of the word differential counting before?
Yes.
Dekat mana? In which subject?
No.
Yeah,
Microbiology, I think. I don't know.
microbiology. Okay,
Hematology.
hematology. Okay, basic or advanced? Okay, an astounding silence there. Somebody mentioned about hematology. Yes, you should have come across these words in hematology. When you come to the third year and when you take this subject, we make the assumption that you still remember what have been taught, and now prepared to get into the laboratory. Now, blood film or blood smear is something which is routinely done. Okay, and the blood film or blood smear is prepared using either blood or bone marrow. Yeah, but the focus of today's class is on the blood. Yeah, we do not cover the bone marrow part. Most lab do this manually, although there are attempts and machines that have been that are commercially available that try to automate the process. Do you guys want to see one of these videos?
Yes.
Kat mana nak share ni ya?
One, today we are working with the quick.
How to share this? Sekejap. Macam mana saya nak dapatkan view saya yang Besar tu. Masya Allah. Sorry, saya ada satu kotak yang kecil je untuk Zoom ni. I don't know what happened. Kat mana saya nak share? Slide saya masih nampak ke?
Nampak.
Nampak.
Here. Oh, I have to stop sharing my slide. And then I share my... Do you see the YouTube?
Yes.
Okay. Ini saya...
Slide 2 plus,
Okay.
it is a
Dengar tak?
automated
Okay. Okay.
hematology
So this is
slide
one
stainer.
of the
It can stain
videos
both,
showing
blood smears and bone
something which
marrow
is
smears.
a
It does one
simple
slide at a time, so this is not for
machine,
high volume
okay.
laboratories. Since
that-
it's been sitting for a while, we're going to prime it first. So we press F4 to continue and then F1 to prime. So it drains out everything that it possibly has in the cuvette first, and it's also then going.
Okay. So as you can see, dia tidak buat ni secara manual. It's not done manually. This machine is quite crude machine. They have some buttons here, and this is a place where they put their slide. The machine will do the smearing, and then it will also do the staining as well. Everything will be done here. So this machine can only do this one at a time. Okay, so you can see that although it is automated, there are also challenges and limitations. Yeah, it can only be done once. And when I run this, I can see that it takes some time, yeah, to get one slide. Although at the very end of the procedure, the slide can be good lah in terms of the quality of the smear. Cuma dia quantity is very low. So if you are working in a very busy lab, in a busy hospital, this machine will not be suitable. Yeah, it's much quicker to do it manually. If you are good, if you have done a lot of smear, you know the technique, you can be faster than using this machine. But this is just want to show to you one of the earliest machine. Yeah.
Prime the line. So right now it's priming the stain line.
So they have the stain in the bottles with the wires. Maybe they got a pump.
Okay, everything that goes in
It's
comes
a
out
waste.
and ends up going in the liquid waste. And that is not something you're going to dump down the sink.
So the system is quite
Make sure
clean.
you tell your professor when it's full.
So you see there is
All right,
the
so it's still draining the cuvette,
slide,
priming
yeah,
everything,
priming
and I'll
the
get back to you when
slide.
it's done.
Priming means
Okay,
they
so
are
now it's
preparing it,
telling me how many cycles I have remaining.
washing it,
I have
etc.
29 left, and I can either prime again or I can continue on, and I'm going to continue on. So F4, and like I said, we have blood smears today. This is not a good slide because of that rip right there, but that could have been in transport.
So
It
that
wasn't there
is
when
the
the
kind
slide
of
was made.
smear that you
Okay,
want to produce.
Let's go ahead and press F1 for the blood, and then it's going to prepare the cuvette when I press F4. So we have to wait, obviously. It's preparing the cuvette. It's going to add some stain in there.
Okay.
And when you put the slide in there, you want to make sure to place it so that the frosted edge is facing you. There is a little slide holder right there, a little slot. Okay, make sure you look at that when you're putting it in because there is a space in between here, and if you put it back there, it's not going to do anything for you.
Sorry, I have
Okay, so
to correct myself. This is
stain
not
when
the
you're ready.
smear. This is only for the staining
And
part.
now
Yeah,
it's going
automated
to stain.
staining.
Okay, this is going to be a few steps.
There's another
and it's
one
going
for
to
the
constantly count
smear
down in each step,
machine.
and I'll get back to you when it goes to a new step.
Okay, I'm making it
Okay, so
faster. Okay,
back.
so
Now it's
the
coming in
machine
a little bit here.
fill up
Very cool.
the area here with the staining with the dye. Okay, and then also it then
Pushing it around a little bit,
wash
and now it's going to drain.
and then drain and then dry. Okay,
Rinse that.
so a few
During any-
cycles, I believe.
Now, okay, I did not cancel it.
Mhm.
I'm here. If you
So
do it,
finally they
if
got
it's
it
been sitting
stained,
for a
yeah?
while and you have not primed it before you start, you'll get a slide that looks like this, and
Okay.
that's not good. Not evenly distributed. Of that, you would then move on to your microscope, and thank you so much for watching. If you like this video, please go ahead and like it down below and subscribe to my channel. I try to add videos as much as I can. Bye.
Okay, do you get the last part of it? Nampak ke tak nampak?
In this video, I'm going to show you how to make a peripheral.
Sharifah, do you see the video?
Yes.
Right now,
Hah? Sekarang nampak ke tak nampak?
sekarang tak nampak apa-apa, doktor.
Tadi nampak kan sampai dia dah stain. Can you see the fluid move in and then the person said that he's going to wash? Okay. Nampak ke tak nampak? I need your feedback. Yeah, if I ask a question, I need to hear you say that you have seen it or not. Huh?
Tadi ada nampak video, sekarang tak ada.
Okay, sekarang memang tak ada, tapi tadi ada Okay.
Tadi ada.
Boleh tak bila saya tanya korang nampak ke tidak, somebody answer me. Ke kita ada lagging ke, saya tak tahu whether my line is okay or not.
Boleh, doktor.
Boleh, doktor.
Okay. I think I'm not going to show you another video lah. It's just too clumsy, right? Where are we now? I'm going to share to you the lecture slide again. Okay, well, I've put the link on my slide, okay, that you can go back and watch, yeah. So the point is that there are machines these days that try to automate the process, yeah. But most of the labs in Malaysia, we don't have that luxury. Perhaps it's good because we don't have to always spend money for something which is still new and still have a lot of limitations. Yeah, and like I said that at the moment, the way I look at these machines, they are still quite slow to operate. Okay, and it's much better to do it manually at the moment. Okay, whichever method, however, that you use in the future, yeah, whether it is an automated or a manual method, actually it's not much a problem even if you do it manually. It's not that like everything which is automated is definitely going to be better than the manually operated one. Yeah, sometimes the manual technique has its own advantages. So the point is, when you get into the lab, try to master the manual technique so that even if you are thrown or you happen to work in somewhere which is very disadvantaged, yeah, pedalaman contohnya, or you try to work in Africa, Papua New Guinea, yeah, you don't have problem. Yeah, these days we heard that there are not that many posts, so you have to think of maybe getting job somewhere else, not only in Malaysia. Yeah, viral sekarang ni apa, doctors bekerja dekat Brunei contohnya. Okay, So maybe I do not know if the market or the posts are too too difficult to get, too competitive. You have to think of going abroad as well. Anyway, as long as the final results, which is your black smear, is of good quality, it doesn't matter whichever method you want to use. Yeah, it's the final result which is important. Yeah, remember when we talk about quality, the meaning of quality is right first time and fit for purpose. Right first time and fit for purpose. Yeah, so you want to achieve that. We have a lot of, we know that it's not very easy to be able to do blood smear. You can watch on YouTube. Yeah, people who are very experienced as well, when they were making the video, suddenly all of their smear were not good, yeah, because of the pressure. Dia nak tunjuk depan video kan. Saya pun kalau dalam lab pressure jugalah bila saya nak buat tu, ya, sebab nak tunjuk depan student, buatnya tak jadi je. Pressure. So apa ni, but when you're in the lab, okay, you need to be able to perform well, yeah, as little mistake as possible. Now, why do we do blood film? Okay, kenapa kita nak buat blood film ni? Okay, is because the blood film enable us to evaluate specific type of cell line. Yeah, specific type of cell line. There is what we call the differential diagnosis. Yeah, differential calculation of the different type of cell tu. Kita boleh tengok RBC, Wbc and platelets. Okay. So okay, and the blood film is useful for making diagnosis. For example, if someone has anemia, yeah, and appear pale, lethargic, when they present to the clinic, we want to then do the blood count. Yes, we can do it automated blood counting, but sometimes the machine can, when we look at the result, there might be something which is not quite right, yeah, with the automated machine reading. So sometimes we do need to confirm with a manual counting, and then the manual counting also will enable us to get a much precise diagnosis, because we can see the morphology of the cells. Cells that may be presenting with a lot of what we call the basket appearance, they won't appear, they won't be seen by the machine. Yeah, this can only be seen when we do the smear and then we stain. Okay, so useful for diagnosis, useful for monitoring, and as well as screening purposes. And there are also conditions where smear is very much obligatory, yeah, to reach a diagnosis, like the malaria. So we can see whether it's the early stage or end stage malaria, because we can see the parasite clearly. That cannot be done by the machine. Now, how do we prepare blood film or blood smear? You have seen one blood smear before, right? Saya ingat dalam parasitology, at least you have seen a few. Maybe in physiology as well. Yeah.
Yes.
Saya tak tahu Nurul Ain mengangguk untuk which one. Is it for physiology or for parasitology? Yeah. Is this better if you can speak out?
Pernah tengok doktor. Tapi
Parasitologi.
by video saja untuk parasitologi.
Sorry. Okey, tak apa. Saya tak tahu, mungkin ada lag ya bila saya tanya soalan, macam lambat dapat jawapan. Okey, tak apa. Alright. So there are a few ways to prepare the blood smear. Okay. one of the most common method, or what we call the classical method, the conventional method, is what we call the wedge smear. Wedge smear, okay? And there are also cover glass smear and then spun smear type. And even the wedge smear, this is where we have one slide as a spreader and another slide as what we call the blood slide, yeah, where we put out the sample on. So we have two glass slides, two slides, okay? That is basically what the wedge smear is. And for wedge smear itself, there are many methods, yeah, many methods. In our laboratory, in our manual that we will give you, we will demonstrate one of the ways, okay, one of the ways to do it. But if you feel that that way is not convenient to you, many of people with they have what we call a problem with shaky hands, yeah. So they may want to improvise on the method, I mean, by changing the way they move the spreader slide, okay. You can see the videos I put on my slide, the link on my slide. You can, I hope you will click and then watch the videos. Yeah, they are prepared by people who are in the lab every day, and you will see that they themselves, when they were doing the videos, they make mistake and then they will tell you, oh, this is not good, etc. Yeah, it's okay to make mistake. Okay, the point is, it is okay to make mistake. We need to make mistake. Without making mistake, we do not know what is correct. So when you first do the smear and it is not good in the lab, don't stop, don't feel depressed, yeah, carry on. Yeah, you will eventually find your own most convenient method that work. Okay, nanti kita akan tunjuklah juga, kita akan try satu dulu, and then I will come from one bench to another and then advise you. Maybe you can do this way, you can do that way, and then you stick to the one that is most convenient to you. Okay, remember, doesn't matter which method you use. What is most important is the final results. The final results. Okay, so we use anticoagulated blood. Okay, the EDTA tube, blood from EDTA tube. And then normally we use pipette, yeah, a micropipette. But there are also many other methods that people use for dropping the blood onto the slide. Ada yang saya tengok tu pakai apa tu, chopstick, ya. Ada yang pakai there's a much more commercialized way tu, dia ada macam boleh tutup dekat EDTA tube tu, uncap and then put another one, and then kita turn the tube down, and then the blood will come out from the hole in a very nice drop, yeah, right size. With the micropipette, kita boleh buat lagi banyak slide, banyak smear quickly, yeah. Tapi sometimes the drop of blood may be too little, maybe the drop of blood is too much. Sometimes there are bubbles. That is the disadvantages of using the micropipette. But kalau yang pakai yang specialized cap tu pula, dia ada hole, and then the blood will drop down due to gravity onto the slide and produce a very well-rounded, nice shape, nice amount of blood. Yang tu dia slow, sebab you need to wait. Lepas tu you need to move to another slide. It is slower. Okay, it gives you a much, how to say this, a quality drop of blood, but the time is another problem. Yeah. Okay. So apart from the blood that the EDTA, the blood from the EDTA tube, okay, sometimes we use other materials lah, like the Buffy coat smear. We can take that one out and do the smear just similar like the one for red blood cell, but for white blood cell. And then we can also use the thick blood smear for blood parasite. But here on the in this lecture and for our lab session, we just do the normal blood smear, yeah, the common blood smear. Okay, so for making the blood smear, I'm going to explain about the wedge blood film. Okay, commonly we use the EDTA blood, which is not too old, yeah, not too old. What is meant by not too old is that it has been taken within the period of 2 to 3 hours. Sometimes kita kalau kita nak pakai sampel tu dia dah lebih daripada 3 jam, we have to manually evaluate the blood whether it already become too clotted or not. Kalau belum lagi, actually boleh lagi. Dia actually sebenarnya as long as dia tidak clot, belum clot. Okay. So as a rule of thumb, within 2 to 3 hours, we have used the specimen. Okay. The blood may change. The red blood cell morphology may change. Yeah, it can produce crenation or speculation. If there are excessive amount of anticoagulant, if it is old blood, yeah, or the environment is too warm. So these are the things that we need to be sensitive about, yeah, not to use old blood. Make sure that the laboratory or the transport or the storage area is at the right temperature, and then look at the sample. Look at the sample itself. Kalau belum 2 jam lagi tapi dah clot ataupun showing crenation, for example, you jangan take things for granted. Must still check the quality of the blood. Oh, dah dekat 10 minit, kurang 10 minit. Okay, so wedge blood film is the easiest to handle, is the most common, most convenient, and it is of the push and pull types. And we use 2 glass slides, yeah, 2 glass slide, 2 hands method basically. So the procedure is you need to place a drop of blood on a clean glass slide. Okay, clean glass slide. So when we take out from the box, it is already clean and it is already sterile. Yeah, sterile. Satu bench akan dapat berapa, satu kotak penuh lah, satu bench. So you'll be sharing 4 of you per bench kan, 4 of you per bench, and then you do the smear. Tapi nanti kalau dah habis, just wash and then dry and then you can use again. Okay. And then this drop of blood ni dia kita nak kecil je. Kecil tu macam mana nak cerita That one memang subjective. Yeah, we have to do it in the lab. We see it, we know that is enough. Difficult for me nak kata berapa. Okay. And then use spreader slide. Satu slide kita drop blood on. Another slide we use as a spreader. It also must be clean. And then the angle must also be correct, yeah, about 30 to 40 degree angle. Of course, when you are doing it, there is no tools, no one will come and measure, oh, this is 35 degree, no, this is wrong. No, tak ada, kita bagi estimate saja. You have an estimation, yeah, a subjective estimation. Okay, so you control the thickness of the smear by changing this angle, ya. Situ kemudian you pull back and then you push so that it become a smear, ya. So then you allow the blood film to air dry completely before staining. I always like to ask the student to imagine an airplane that is going to take off. Macam itulah keadaannya. The airplane, kapal terbang tu dia akan disuruh untuk berundur sikit, okay. Kemudian dia akan mula berlari dengan pantas di atas landasan dia. Okay, so macam itulah juga dengan smear tu. You kena tarik sikit, kenakan pada blood yang dah dititikkan itu, tunggu sekejap biar darah tu meresap dan mengalir ke seluruh tepian spreader slide. and then the airplane will start to move along the landasan and take off. Sebelum landasan tu habis dia kena take off lah. Tak boleh tunggu landasan dah habis pun masih lagi tak take off, ya, and then terbabas. So similarly, okay. So this is the two slides, ya. Satu slide yang kita panggil blood slide or flat slide, whatever lah. And the other one is the spreader slide, ya. Ada dua, satu sini dan satu di sini. So we first drop the blood here. Kadang-kadang ada frosted slide, tapi tak kisahlah. Kalau ada frosted slide, kita drop just after the frosted area, not on the frosted area. Kalau tak ada, you just pick whichever ends. And then we back the spreader slide, ya, push back. Okay, dia kena pada drop of blood tu, then it will spread along the line here. Let it spread, ya. Jangan terlampau pendek. You need to let the blood to spread about 80 to 90% of the edge. Okay, tak nak juga sampai ke tepi. Although I've seen people on video, they wait until it reach the edge, but I would like to caution you on that lah. If we don't need to wait, nanti kan terkeluar habis pula. About 80 to 90% is enough. Janganlah only about 50%, nanti tak sempat nak leretkan dia. So about 80 to 90% is enough, and then you push forward, okay, and then it will produce a smear like this, ya, yang bawah ni. The aim of this smear is to provide an area where the cells, okay, at the side here, the cells here are all one cell layer. Ketebalan kat situ satu sel je. Kalau dekat sini, dekat tempat the blood was dropped, okay, kat sini, these are very thick area. We look underneath the microscope, we cannot see individual cells. Okay, at the tail end here, this one terlampau sedikit sel. Nampak satu tapi terlampau sedikit. Itu pun tak nak. We want an area where it reflects well the situation, yeah, for the person. So it is in the middle area here. Okay. So ni mungkin tak apa clear, but you can see this is the drop where the blood was dropped, and then the blood was smeared across here. Sepatutnya dia letak sini lah. Selalu kita letak kat sini, tapi orang ni terbalik. Okay, dia buat okay, tepi-tepi tak sampai, very nice. And then there is a curve, yeah, a crown shape area. We call this a feathered edge. Feathered edge. Sisi yang macam bulu pelepah yang cantik, dia punya crown dia. Okay, this is the kind of smear that you want to produce. So it's not, it is thick and then it's begin to thin, very thin. So we want to watch or view under the microscope in this area here. Okay, when you push this smear, when you smear this slide, macam ni kan dia macam from here to here dia macam 60 to 70%. Nice lah. Kita tak nak terlampau cepat kapal terbang tu naik. Okay, kapal terbang sini, belum apa-apa dah naik. Tak nak. Kita nak kapal terbang tu ada ni sikit, buat lajak sikit. Okay, dia lari kat sini, dia naik. Dia naik. Nice je dia naik. Okay, you imagine that. When you want to do the smear, you imagine like an aeroplane which is taking off. Okay. Okay, characteristic of good smear, thick at one end, thinning out to a smooth, rounded, feathered edge. Kita tak nak orang ada tangga. Nanti banyak yang ada, because they are shaky, they are not confident in the first time. Oh, darah, titik-titik, and then put the smear, lepas tu dia nak tarik tu, pilot yang tak cekap lagi kan, then dia kejap dia nak break ke nak naik kejap. Jadi dia ada tangga. You will see that stairs. Okay. Jangan senyum Nurul Ain. We want to see yours. Okay, should occupy 2/3 of the slide area, 70%. Should not touch any edge of the slide. Should be margin free, except for the point of application. Okay, so these are the parts of the smear. There's a tail, Should be nice feathered tail. Kalau slide awak tu spreader tu kotor, you will see a lot of lines. Okay, nanti ada line kat sini. Kalau slide tu kotor juga ada bubble, ataupun titik-titik kat sini. Macam-macam apa ni, contaminated fibers etc. ada. Okay, we don't want all those things. So your slide must be clean. Your drop of blood must have no bubble from the beginning. Okay, so tail, body, and head. Those are the components. Okay, I think I have to stop there. We take 5 minutes break. Okay. Okay, so we were at this slide before the break. Yeah, I mentioned about the components of the blood smear. Yeah, the tail, body, and also the head. Yeah, this is the right slide. Okay, so if we view underneath the microscope, these are the kind of cells that we will see. At the head area where it is thickest, we see cells will be overlapping. Okay, and then at the body area, this is the normal blood smear. At the tail, there's a lot of blank area. Okay. Which does not actually represent what is actually the status of the hematology system. Yeah, this is artifact due to the way the specimen is being prepared, because here less cells are present in this area. Okay, so when we look at the different area of smear, we must know what we look for. We must know which part is reflective of the hematological status. We must beware, but don't be fooled by certain presentation that we see. Yeah? If we look at the thin area, this is a common mistake where a common mistake or common conundrum, to speak about conundrum, because we can see what we might term as spherodocytes. Okay, spherodocytes, which is small and flattened red cells, yeah, which could be misinterpreted as signs of spherocytes. Okay, whereas they are not. Spherocyte is a clinical diagnosis. Yeah, so kalau kita tengok dekat thin area tu, kadang-kadang dia ada banyak kat situ. Okay, but this is actually spherodocytes, and it is due to the manner, the way we perform the smear. True spherocytes, okay, will be found in other areas of the smear. If the person is really a spherocyte or have spherocytosis, we will see the spherocyte in other parts of the smear as well. So this is one of the ways to not be fooled, but we see at the thin area. At the thick area, it's common to see what we call hulo. Okay, hulo. Yeah, hulo is not. We are not familiar with hulo because kita tak pergi ke casino etc. But for those who know, hulo is like stacks of coin. Kalau kita ambil coin tu ataupun buah carom lah, buah carom kita selalu tengok kan, buah carom tu kita buat bertingkat-tingkat kan. That is hulo. It is normal in the thick area, and if the person has got a true hulo, we need to examine the thin areas. Yeah, we will see the hulo also forming in the thin area. So if you happen to only stick to the thick area, you might see hulo and you may misinterpret the data. Yeah. So common causes of poor smear. Firstly, with regard to the drop of blood, could be too large. Maybe kita press the micropipette too much, or too small. Yeah, too small. Spread the slide, push across the slide in a jerky manner. Maybe you are not confident. You have not taken your breakfast. You are very hungry. Can also be the cause. Or somebody push you, I do not know. Okay, those are the reasons why jerky manner can be seen on the slide. Failure to keep the entire edge of the spreader slide against the slide while making the smear. Okay, that's another problem. So you will see it, yeah, on the smear. Setengah orang dia spreader slide tu dia tak duduk betul-betul atas tu. Dia sebab dia tak confident lah mainly. So dia ada separuh terjongkit sikit sebelah. And then when they push the smear, dia ada sebelah je nampak, sebelah lagi tak ada. Okay. Do not smile because you may be the one doing that. Okay. Failure to keep the spreader slide at 30-degree angle with the slide. Okay. And then failure to push the spreader slide completely across the slide. Ni yang saya cakap. Dia hanya dia masa dia nak naikkan kapal terbang dia tu, baru sikit je dia naik. So dia sikit je dapat. So on the runway, the aeroplane must run for about 60 to 70% of the runway baru dia take off. That will give you a very nice smear. If you have a cheap slide yang cheap ataupun slide yang ada apa ni, ada bukan retak ke apa kan, kaca dia terserpih, and then can also cause irregular spread with ridges and long tail. Okay, or perhaps the slide is dirty. Okay, I could cause this. Okay, what number 7? Holes in film. Yeah, the film is supposed to be smooth, but a poor smear has holes in them. Could be because of fat or grease. Yeah, maybe your hands touch the area. So itu pun satu masalah juga. Or you have used you recycle the slide and you use very fibrous tissue. So the fibers of the tissue or the cloth is on the slide. Okay. Also, common cause is cellular degenerative changes due to delay in the fixing, inadequate fixing time, or method contaminated with water. Okay. Okay, here are biological causes of poor smear. Yeah, sometimes kita buat dah okay, tapi is the problem with the sample and it's due to some pathological problem lah. Firstly, cold agglutinin. People with cold antibody, they have cold agglutinin. The RBCs will clump together. So to overcome this problem, we need to warm the blood first, yeah, and then redo the smear. Now, so of course this needs some information lah, pre-analytical information, yeah, with regard to the person's health status. Poor smear can also caused by lipemia, so it will produce holes in the smear, and nothing can be done to correct this. If the lipemia is due to procedural problem, so you have to ask for a new blood sampling. Gulo, okay, this is the RBCs forming stacks, yeah, resembling a stack of coins, form into coin stack. Kenapa saya tulis into stack resembling coins? Okay, also nothing can be done to correct this, yeah. Okay. Okay, so that is about the smear. Okay, it is something which is you need to master and it can only be done by experience. Cakap-cakap je ni, tengok video, okay, it will help you to visualize, but you need to actualize. You need to actualize. Yeah, you need to do it. So take your time. Do as many smear as you can during the lab session. Now, after we are done with the smear, kita dapat yang macam ni kan. Mula-mula kita buat tu dia akan merah lah, nampak merah kan. We then need to fix and then stain. Okay, why do we need to stain? Akilah.
To see the cells clearly under microscope.
Okay, very good answer. Yeah, you are correct. We then want to identify correctly individual cells. the individual cells. So we use stain. Actually, the ability to stain different type of cells. This is one of the kata apa, the difference between modern medicine, modern science, and traditional science. Okay, without the ability to stain and then to view under microscope, ini perjumpaan yang orang kata yang mengubah paradigm lah, yang menjadikan modern medicine tu modern medicine. Ya, kalau sebelum ni kita tak nampak, kita tahu orang tu sakit, tapi kita tak tahu sebabnya apa. Tapi selepas kita boleh dye, kita boleh warnakan, baru kita nampak, oh, orang yang sakitnya dia demam, demamnya 3 hari demam, 1 hari dia kebah. Kemudian 3 hari demam, 1 hari dia kebah. Demam 3 hari kita panggil. Okay. Ataupun 4 hari demam, 1 hari kebah. Kita panggil demam sadasa ataupun demam rubuk. Itu bahasa Arab lah. Kalau orang Melayu panggil demam kura. Tahu demam kura? Demam kura apa? Demam kura is demam malaria. Malaria, okay, demam malaria. Kura is the Malay word for spleen. So when people have malaria, their spleen becomes enlarged. Hence, they call it demam kura. Not all malarial presentation comes with splenic enlargement, but there is one of the feature that differentiate malaria than other type of fever. Yeah, the common feature lah. Okay, now the malaria dia memang ada cycle, ada cycle because it coincide with the time when the parasite is move out of the cell. Bila dia move out of the cell, dia become demam, kata Ustaz saya. Okay, so bila dia masuk balik dalam sel, dia hilang demam sekejap. Macam itulah. Mungkin saya terbalik. But that coincide with the cycles, life cycles of the parasite. So dia ada period that is feverish and then period which is non-feverish. Now, without the ability to stain, we won't be able to see clearly what is inside the cell. And then without the ability to without the microscope, we won't be able to see cell. And hence, whatever we dye will not be seen as well. So they comes hand in hands together. So saya dah masuk sejarah perubatan pula tak apa. Sometimes we need to look back, to look back. Kita tak boleh drive kereta mandang ke depan je tanpa tengok belakang. Sometimes we have to look back. Okay. Now, so in hematology, we need to fix and stain. So what kind of stains is available to us? Okay. Have you heard of Romanowski staining? Romanowski. I'm sure you have used, so Romanowski staining, there are plenty of them, one of the most common stains that we use in my hematology lab is what we call the Leishman's staining. Awak tengok nama Romanowski staining ni, Jamesas, Janus, Wrights, and then Leishman's. Okay, these stains are known according to those who first formulate the staining, the staining. So macam Leishman's, he was a Scot, orang daripada Scotland. Apa nama dia tak ingat lah, tapi Leishman lah nama dia. So he formulated this, and we use this in hematology lab often. There are also other, actually in hematology kita pakai juga yang lain ni, Jamesa, Jenner, Wright, boleh juga pakai, tak ada masalah. In our lab, I think we will use Leishman for our practical. So I'm going to talk a little bit about Leishman staining here. You can read more on the Romanowski staining if you want. When I was at my degree level, all these stains, I learned under histology and cytology subject. So dia ada more emphasis during pathology and also under anatomy. Itu masa itulah. So once I come into hematology, I assume, people assume that everyone knows about the basic of the staining. So if you want to read further, you go back to your first year, second year notes or to the reference text. Now, the Leishman staining, this is a polychromatic stain. What does it mean is that it stains a different type of organelles, different type of cells with different colors. Okay, and it has like methylene blue in it, okay, which stains RNA and DNA in blue-gray color. It also got eosin, which stain hemoglobin, eosin granules, and produce orange-red color. So ini teori lah. In reality, when we look underneath the microscope, mungkin the shade of colors slightly different, yeah. Then not very orange red, yeah. It's like they are the bluish lah, semua itu. Okay, so really need us to see the underneath the microscope and know which one is really normal and what is not normal. And with all type of staining, okay, one of the crucial component is the phosphate buffer, yeah, the pH. So the timing, the exposure of the length of time the stain is exposed to the sample. These are all the crucial things to consider. Okay, this is the procedure to do the Leishman staining. Of course, some labs, they might have slight variation. Okay, this is one of the protocols. Yeah. So thin smear are first air dried. So once we do the smear, blood tu akan Belum. Kenapa masuk? Ya, dah.
Dah.
I'm very sorry for the distraction. Kat mana kita tadi? Where are we? Kita dekat sini. Saya tengah cakap pasal thin smear. Okay, so when we perform the smear, the blood will still be fresh, kan? Dia tak coagulate lagi, dia tak clot lagi, kan? So we need to wait until the blood is dry, yeah? And we don't want to put it next to a fan, for example, to dry, or we put it on a heater. Okay, ada heater untuk nak cepat sangat ni, tak boleh. Okay, it has to be a gentle process. Okay, the mixing of the anticoagulated blood pun gentle, and then when we air dry pun gentle, yeah, gentle. So we leave it on the bench and dia tak ambil masa lama pun. So dia dry on its own. Okay, once it is dry, and you know when it is nicely dry, you need to flood the smear with stain. Now we're going to use a pipette and flood. Yeah. So again, no need to be aggressive. Some people, they squirt the stain with a very fast flow sampai terkoyak smear tu balik. We don't want that. Just a nice gentle smearing. And so as long as the whole area is covered and flooded a little bit, and then stain for 1 to 5 minutes, add equal amount of buffer solution and mix the stain by blowing into the fluid. Again, blowing gently, not like habis semua. No, it's not ribut taufan. You just need a small blowing. Leave the mixture on the slide for 10 to 15 minutes and then wash off by running water. Again, how to wash with running water in a gentle manner. So firstly, the amount of the pipe water, running pipe water should not be very big, but should not also be too small. Small ni pun kadang-kadang dia boleh koyakkan. So just nice, yeah. One of the ways, if you have, especially if you have a lot of slides, you can take a rack and then arrange your slides onto the rack and then put it in a container, okay, and then turn on the tap water. Let the drop of the tap water tu dia jatuh dalam container tu, but not directly onto the slide. Dia akan fill up the container and dia akan overflow. Okay, so there is a very nice way to wash things gently, okay, to let the overflow. Dia tak direct to the thing that we want to clean, dia akan overflow and then that will take off all the material that we don't want. So okay, yang kat sini on the slide ni kita wash gently on the area tu gently to prevent residue of any precipitated stain, tapi sekejap je. Okay, and then you can do also the overflowing method. And then stand the slide on end and let dry in air. Again, gently. You can use tissue paper, serap tepi-tepi, but do not rub on it. Do not put on heater. Do not blow with a strong fan, etc. Okay. Maaf sangat-sangat. Right, where we are. Okay. This is how the appearance of the slide after staining. Yeah. So this one here you can see is too acidic. It's very bukan very lah. You can see is angry. Yeah, the color yang merah tu. And this one here, the color, the bluish color is too much. Yeah, too much. So you want it like in the middle. It's still red. Okay, the spectrum of color is red here. Here the shade is bluish purplish, yeah, and then area in the nucleus is nice purplish color. This one you can see is very dark purple. Okay, a very dark purple. So again, you need to see a lot of these slides. Yeah, so I suggest you to see a lot of books and then watch a lot of videos as well. Your generation is blessed. Yeah, my time, very few online resources. Your time, Internet of Things lah, apalah semua online. You can do revision online. We can do class online. Macam ni, nobody marah kalau dulu lecturer bagi kelas online. Habislah kena marah. Macam tak buat kerja dia kata kan. Duduk kat rumah je. These days, I'm happy to be at home. Tapi ada banyak distraction lah. So, okay, jap. So too acidic, suitable and too basic. So go and watch videos and on the internet and you can do quizzes as well. Dulu masa zaman saya sangat sikit resources. When they started to put quizzes online ni, dia macam happy sangat-sangat dapat try all those questions online and then do self marking, etc. So your generation is too blessed. Okay, jap. Kenapa tak gerak? Okay, so if there are two acid, you can see it, is angry appearance. Could be because of insufficient staining time or too much, too much also, or prolonged buffering, prolonged washing pun boleh juga jadi, and then maybe the stain is oldish. So depends lah. You have to try a few things. So try to lengthen staining time, check if the stain is okay or not, what's the pH of the buffer, and then with the buffering and wash time, shorten it. Okay. Kalau saya tersilap cakap, minta maaf kerana tengah present ni dia saya tak apa ingat siapa saya cakap apa, but it's this on the slide is what you should do. Okay, if it is too alkaline, macam too dark purple, too dark blue, these are some of the reasons lah. Maybe the smear is too thick, and the staining is too prolonged, too long, washing perhaps too short. Okay, and then again the pH, the buffer solution, for example, You have to correct all this. Okay. Right. Any questions so far? So we have talked about how to do smear, how to analyze our smear. Yeah, what causes some of the what quality do we want and what causes some of the bad smear. Okay, itu satu. And then we talk a little bit on the staining. Yeah, so I hope at this stage you can appreciate why we use what type that type of stain. And macam Leishman tadi, kalau katalah kita habis stok Leishman, you want you need to still continue staining, you can try to use any other Romanowski. Sebab dia same principle, same group lah, same family of staining. Yeah, there are some people who say that it's not very satisfactory, it's only can partially replace, but it is something that is better than nothing. If you don't have Leishman, your Leishman rosak ke apa ke, you can replace with other type of Romanowski stain. And this Romanowski stain, dia ada pantang larang, so you need to view. If you get the nice staining, is good. If you have too acidic or too alkaline staining, you have to look back at your stain and your method, and change accordingly. Now, once we have stain and it is time for us to view. Tadi siapa tadi in the beginning mentioned, Akila I think, mentioned that the purpose of making the smear and the staining is so that we can see individual cells. Very correct. We can see white blood cells, platelet, RBC. Itu tiga yang utama lah. So under the WBC, white blood cells, there are other subtypes, the neutrophils, eosinophils, etc. So we want to see these cells. We want to see the normal ones. At the same time, we also want to see the abnormal ones. Kalau kita nak come to a diagnosis, we do want to see whether there are the abnormal cells. Okay, so the staining will, the smear and the staining will allow us to do this. Let us look first at the WBC. So this is for the WBC. These are the principles. First, we need to check for the distribution, and then estimate the number present. Nanti ada satu macam calculator, enumerator, where you press. Once you see the cell, you press until we get a count. You don't have to look to all over the smear, only in the body part and in the zigzag way, and then get an estimate. So it has to be evenly distributed, and then we make an estimate of the number of cells that are present. Look for any gross abnormalities. Okay, note this. Okay, and then perform the differential count and examine further for why the for morphological abnormalities happen. So this is the place, the body area tu. So ada part yang very dark, very dark. This one we don't want. The head we don't want. The tail we don't want. We want this part, the interface part between the thick and the thin. So the way we do this is that we move. Kita ambil satu area kat sini, and then we count the cells, the number of cells, and then move and count, move and count, move and count, move and count, until we get an average. Okay, so observation is performed under 40 times. Dry with no oil. Okay, choose a portion of the peripheral smear where there is only slight overlapping of the red blood cells. Count 10 fields. Take the total number of white cells and then divide by 10. Okay, there's a formula for this. And then platelet. Secondly, we look for platelets. We want to estimate the number that are present and then examine for morphological abnormalities. We observe platelets under 10 times. Check to see if there are good counting areas available, free of ragged edges and cell clumps. We do this for all type of cells. And then check the Wbc distribution, check the slide is properly stained, check for presence of large platelets, platelet clumps, fibrin strands. And note all this. So platelet ni senang, semua senang nak tengok if we know what to look for. If we observe platelet under 100 times, we need to use the oil immersion lens. Choose 5 to 6 fields and then take an average, multiply by 20,000. 20,000. Not any microplatelet. Microplatelet, big platelet, and sometimes you have to be careful. Sometimes it's not big platelet, but a few platelets which has clumped together. Okay. So the platelet, the number of platelet per oil immersion field gives some indication lah of the status of the platelet count. Dia tak very objective. Kita tak dapat nilai yang tepat. It's only an estimate. An estimate. So if less than 8 platelet per oil immersion field, that means the platelet count is low. 8 to 20 is okay. More than 20 means that there is a very high number of platelets. Itu macam kata apa, a rule of thumb. Okay. Now, what do we want to see, or what do we evaluate when we say we want to evaluate the Wbc formology? Okay. First and foremost, you need to know what is normal first. You need to understand that the Wbc there are 5 major groups. Okay. And what are their individual presentation like? Okay. And then kita tengok ni lah, hypersegmentation of the cells. Okay. 5 or more lobes is considered hypersegmented cell. Kalau macam the most segmented cell is the neutrophils. 3 is common, 5 is still considered normal, but more than that, for a neutrophil even is a hypersegmentation. And then vacuolation of the neutrophils. Vacuolation is not supposed to appear. Okay, nanti dia nampak area yang tak ada granulation, tak ada nucleus, tak ada granulation. There is a vacuole there. And then toxic granulation of neutrophils, another presentation. The granules is maybe too dense there. And then dollar bodies, also a type of presentation regarding the granules. And then atypical lymphocytes, smudge cells, etc. There's a lot of it. We will show you the slide at the end of this presentation. Okay. So this counts for the manual differential count. We are the white blood cell, dia ada 5 subset yang paling utama. So we need to then do a manual differential count for each of them. These are done in the same area as Wbc. Yang tadi saya tunjuk first kali tadi, kita count all. Okay, kita count all. Now we want to do the manual differential count. Okay. We use the 100 times count the 100 Wbc, including all cell lines from immature to mature, and then we report the results using this formula. Okay. Tips on the differentials. Do not count cells that are disintegrating, like smudge cell, eosinophil with no cytoplasmic membrane, eosinophil with scattered granules. These are indication that they are disintegrating. They are at the end of their life, or they are something which is abnormal is happening and they need to be destroyed. Hypnotic cells, where the nucleus is extremely condensed, so it is a sign of degeneration. The lobes condense, there are clumps. Okay. And then the basket cells, these are signs of disintegration. Okay, smudge cells. Okay, You can see here smudge cells. Dia macam apa panggil? Splash. Okay. Hypnotic cells. Here you got one hypnotic cells. Yeah. Sorry, bukan untuk yang ni. Here, hypnotic cells. Yeah. So you see the nucleus is supposed to be one clump, satu area lah yang integral, ya, yang intact. Tapi yang ni dia dah pecah-pecah, and then you can see there is like an eye, kat sini ada satu titik. Maybe the smaller one you don't see it, but here you can see again. So these are presentation that we call the hypnotic cells. Very dense. It is nucleotic material. Apa ni dia, purple or bluish, and then you have that macam one more central area of very purplish area. Is actually a very dense area of the nucleotic materials. Okay. So abnormal differentials from 200 cells. Okay, if Wbc is more than 15, you have 3 or more basophils, so these are all abnormals. More than 5 immature white blood cells are seen. Okay. Okay, and then if any cell is extremely elevated, like you have bands, monos, or you see nothing more than 20. So bands, neutrophils, this can be part of a normal presentation. Tapi if you see too many of them, that means it's abnormal. So we need to note them. Okay, we stop here, and then we go for the Rbc blood. We stop for 10 minutes, perhaps longer time. Thank you. All right, everyone. Okay, I hope we can finish this by 4, yeah, perhaps. The next one is the Rbc. Yeah? And when we look under the microscope, we want to check for the size and shape of the Rbc, look for its hemoglobin content or relative hemoglobin content, any sign of polychromatophilia, right? That is in terms of the color, any sign of inclusions, holo formation or agglutination. Now, when we look at the Rbc, sometimes the Rbc could be nucleated. Yeah, nucleated. In some situation, the Rbc still have its nucleus, and we might count these nucleated Rbcs as Wbcs. Okay, kalau dia ada, if there is only 1 or 2, maybe you can leave it lah. But if we happen to notice that there are more than 10, some people, they are more strict. They say more than 5. Yeah, so it depends on your lab lah. What is their cut-off point? So basically, if there are many nucleated Rbcs that could be seen, you need then to correct the white cell count. So to correct the white cell count, this is the formula Wbc that you have counted times 100, and then divided by the number of the nucleated Rbc plus 100. Yeah. So then so that we make the assumption that some of the Wbc that we have counted could have been nucleated Rbc. So this is a guesstimate of the number of nucleated Rbc that need to, and then we get the corrected the white cell count. Okay, so for the Rbc morphology itself, we normally scan using the oil immersion under 100 times. We then identify time fields and observe for size, shape, hemoglobin content, and present or absent of inclusion. Then the red cell morphology is assessed according to a grading system. we want to ask ourselves, yeah, if the morphology can be seen in every field, if the morphology is pathologic and not artificially induced. So these are some of the inclusions, RBC inclusions. Yeah? For example, the Howell Jolly bodies. So this is the image. See a enucleated RBC with a black dot, yeah, a densely area there, yeah, which should not be there. And that one is actually a dense area containing DNA material. Heinz bodies, we use supravital stain to see this, and normally it needs some info lah that the person may be G6PD apa kan, baru kita pakai stain tertentu. And then Pappenheimer bodies with a larger apa ni, the denser area is larger and correspond to the history. Yeah. So in the Howell Jolly bodies, this is DNA, but in the Pappenheimer bodies, corresponding to the thalassemia, hemolytic anemia, this is caused by iron deposits. Yeah. And then we have hemoglobin H inclusion, again under supravital stain. And then there's a lot of granules that should not be there. It's actually the clumps of the hemoglobin. Yeah, the clumps of the hemoglobin. And then the basophilic stippling, you see the area in the middle, the paler area, it has got some stipple area ataupun apa bahasa Melayu, area which cause the well-rounded area have some areas which are stipple, area yang tak well-rounded. Okay. Okay. How do we record? A normal red blood cell should be approximately the same size as a normal lymphocyte nucleus or 2 normal size red blood cell. Okay. So this is the number of the red blood cell per oil immersion field. 1 to 6. So the grade of the abnormality is denoted as this, yeah, 1 plus if the number of abnormalities is between 1 to 6. If it's about 7 to 10, then we denote, we grade the degree of abnormality as 2 plus. 11 to 20, 3 plus, more than 20, 4 plus. Okay, so where possible, use macrocytic and microcytic, yeah, rather than anisocytosis alone. Anisocytosis refer to the abnormal shape, so dia tak bagi tahu besar atau kecil. Okay, anisocytosis. So it is better when we report, we write it down, macrocytic or microcytic. Okay, and this is done by you in the lab. It's not done by the medical doctor. So when they get the result, the report of the result, it says macrocytic or microcytic, they understand lah what is happening. Use specific cell morphology where possible rather than simply reporting poikilocytosis. Again, poikilocytosis also referring to the abnormal shape. Tapi which one? Yeah, is it echinosis? Is it blister cells? Okay. When red cells are normocytic, normochromic, and then we report out as normal, don't have to write normocytic, normochromic. Yeah, normal is already denoting the size as well as the color. Okay. When abnormal morphology has been noted, never indicate normal. Okay, never indicate normal. So how this is an example of how we report result. When there are 7 to 10 microcytic RBCs per oil immersion field, we write then as 2 plus, okay, which is the grade, microcytosis. Kalau tak nak letak 2 plus ni, then we say moderate microcytosis. Okay. So ini tadi dah cakap tadi. Now, morphology of the WBC. What are the abnormal WBC? Yeah. So this is the normal. You see the neutrophils, yeah, with lot of loops. You can see they sort of have bridges there, and then you see the eosinophils, yeah, lobes as well with like orange, red cytoplasm with granules that can be seen, lymphocyte with nucleus which covers more than 2/3 of the cytoplasm, yeah. The monocyte again, a big cell with a big area of nucleus as well, and then the basophils, 1, 2 segmentation of the lobe with the granulation also appearing, yeah. So neutrophil, eosinophil, and then basophil. Now, so these are the presentation of the Wbc that are abnormals. Yeah, you see band shape here for neutrophils. Yeah, one nucleus for the neutrophils. Okay, and this one is the nucleus of the neutrophil that has not become properly hypersegmented. So dia kena jadi macam ni, kena jadi macam ni. 1, 2, yang ni ada 1, 2, 3, 4. This one dia tak sempat lagi. So these are abnormal. This is panggil apa? Neutrophils that are still young, and then if they occur in the kids, we expect a lot of band neutrophils. But if in adult population like you and me, we expect that most of the neutrophils would be of the normal type. Yeah, maybe we will see 1 or 2 like this, but dia terlampau sikit, very insignificant. Okay. Okay, this is type neutrophils. We call this band neutrophils, diameter 12 to 16, cytoplasm pink. And then we have the band neutrophils again. Okay, not well segmented neutrophils. This is the segmented neutrophils, but still not well, not more than 3, not well segmented. Okay, it's already segmented but not well segmented yet. And then this is the segmented neutrophils, yeah, the proper one. Okay, we see the lobules. Okay, eosinophils there. Okay, this is also normal eosinophils. Basophils, okay, this is a normal one. Okay, normal basophil. This is lymphocyte. You can read lah yang tepi ni. Medium blue, large primary granules, dark blue, round dense chromatin. Okay, monocyte. Now, okay, so this is the neutrophils. Yeah, neutrophils start as a cell with very dense nucleus without segmentation, and then the nucleus start to reduce in size, become elongated instead of roundish, and then elongation turns longer, and then start to segmented, to become segmented, and segmented further until it reach in this part. Yeah, so this variation, yang macam ni memang normal in adult population. Here, normal but in small quantity, not too many. So when you see that the number of band neutrophil is too many in an adult person, so you start to be worried, and you start to think about what could be the cause of this increase. Tapi kalau sikit jangan terlalu alarm lah pula. Saya jumpa satu ni terus call people that this person has got something wrong. No, 1 or 2 is okay lah. These are toxic granulation. You can see the angry red, and then the granules are not nicely nice dots. Okay, our bodies, you can see all these fragments, filaments. Here, long rod, which is not normal. You don't It's not normal. Yeah, in blood cells, if you see granules, is okay, but rods is not totally not okay. This one is hypersegmentation. Yeah, 2, 4, 6, 7. So that one is considered hyper sangat-sangat. Anisocytosis of neutrophils, different shape and different size. Variation is too much here. He's got like a band shape. This one 3 lobes. This one maybe segmented neutrophil but 2 lobes. This one the lobe is not as good as this lah. Kalau yang kita tengok yang normal tu dia macam memang lobe. This one is not quite a lobe. Yeah, segmented. Okay, so varied. The presentation is very varied. Okay, vocalization. You see the areas of the cytoplasm has some blank spaces. You see them also in the nucleus here. Okay, so these are all vocalization. If you see in 1 or 2 cells, it could be artifact because maybe your the manner you do it, or the sampling, or the dirt on the slide. But if you start to see in many of the cells, and that's a true vocalization. Okay, this one, degeneration of nucleus. Okay, the nucleus is gone. Okay. Dollar bodies, you see this, the blue shape here. Okay, there's so many more. Okay, so many more. You can read in the reference text. I haven't put all of them here. Okay, but this lecture should give you some impression of what to expect. Yeah, what to do with the blood sample that we have collected. One of it is doing blood smear. It's not very easy. Okay, don't take it for granted. So when you are in the lab, practice as much as you can. That is perhaps the only time that you have opportunity to do the blood smear before you go to the hospital for your attachment. Yeah, and try to hone your skill. It's not easy, but with perseverance, by the end of the 2 hours, 3 hour session, I'm sure all of you can do a very nice smear. Okay, in beginning memang dia susah. Dia ada teknik yang akan vary from one person to another. Macam mana awak pegang, confidence level, cara awak tarik, dia akan berbeza daripada setiap orang. So when you do it, you don't get it. Kalau awak tanya saya akan suruh awak tukar-tukar lah awak punya method. Sebab saya pun tak tahu apa yang sebenarnya terbaik pada awak. You have to decide that yourself, right? And then some brief introduction to staining. Yeah, what to expect when we do the staining, what to watch out for, and the different ways to report the cells and what are the abnormalities that we might see. Okay, so a well-made smear will provide an estimate of the cell count. In some cases, they are indispensable. You have to do blood smear. Okay, mesin rosak ataupun mesin punya reading is problematic, or there are characteristics that cannot be detected using machine, so you will resort back to blood smear. Okay, they can also provide proportion of the different type of cells much more clearly than the machine. Okay, and then show us the morphology. That is one of the main advantages of blood smear. Okay, I think that's all. Please hold on while I create the ataupun kita boleh stop. I'll send the link to Shakira after this. Yeah.